Motherhood journey is actually complicated, as you will get the details in this hour part 3 of your journey to motherhood. We have actually had part 1, which is introduction, part 2, which is talking about your medical history. On this part 3, we will be looking at all what you need in terms of your checkups. So we're going to look at the checkup that you will need to do when it comes to motherhood. If you are coming across my channel for the very first time, please do me a favor. Make sure that you're following, share this video to someone. Please, those who are watching on TikTok, I understand that you might not watch the complete video, so do it to check the YouTube channel that is the same name, Women's Health Forum. Just search the name Women's Health Forum on YouTube right now. Now, when it has to do with your checkups, because initially I've already said, if you're trying for a baby, make sure that you've consulted, seen a gynecologist. Now, your doctor will go through a whole lot. So, what sort of checkups are we looking at? So there are many of the checkups that are needed, and it is a financial burden. I'm saying burden because not everyone will be financially stable at times to do some of these things. I've had many ladies who have to give up that now they can't. They spend a whole lot of money and so on. But please, it's always good to do this checkup. So what are these checkups? We have one checkup that has to do with your infections. So under infections like what? Chlamydia, gonorrhea, mycoplasma, trichomoniasis. These are all infections that can cause a fertility issues. Now, your doctor has to make sure that your womb is okay. So you have a scan, pelvic scan to check and make sure that the womb is okay, make sure that the ovaries is okay. So you have a pelvic ultrasound. Then your doctor also has to make sure that your fallopian tubes are good. Then you have something like HSG X-ray to check for your fallopian tube. Then your doctor also has to make sure that your egg quality is also good. And you have something like the AMH test. This test is mainly to make sure that the egg quality is good, the egg reserve is also there. Then after all of these infections, a scan to check if your womb is okay and also the ovaries is okay, then test for your fallopian tube, then test for your egg quality. There is also series of tests when it has to do with your hormones to make sure that your hormones are within okay. So we have many reproductive hormones here, including FSH, that's follicle stimulating hormone, LH, luteinizing hormone, TSH, thyroid stimulating hormone, prolactin, mainly for ladies who might have shown symptoms of hyperprolactinemia. But please, this hormonal profile test will depend on probably symptoms that you are showing, because at times you might not show some symptoms, hence your doctor will tell you this hormonal test is not necessary. But when you show specific type of symptoms that are necessary for a specific type of hormone, your doctor could recommend that you do this hormonal profile test. For example, maybe you have, for example, acne, facial hair, your cycle is irregular. This is most likely issues related to polycystic ovary syndrome, and your doctor will certainly ask you to check maybe your testosterone in order to make sure that you don't have polycystic ovary syndrome, and a scan will be done as well to check for the polycystic ovary syndrome. Ladies with breast milk production when they are not pregnant or nursing a baby, your doctor will also ask you to do prolactin in that situation. Maybe your doctor says that maybe you don't ovulate, FSH, LH, etc. So all of this will be done depending on most likely the symptoms that you show. Then your husband. You know, unfortunately, our brothers, that's your husband, always behave as though we are okay. We're like, no, you're an issue. So it's always important, please, if you're a man listening to me right now, it's always important that you follow your wife to the hospital. Please do this checkup with your wife. It is the best when you do it with your wife. So The husband's part is make sure that he too is okay. Because when we talk about all of these checkups that are done in the hospital, most of the time we think that, oh, it is the lady. The lady has a part to play. You also, as a man, have your own part to play, because we need a sponsor and an egg to fertilize for a baby to be formed. If the woman is okay 100%, then the husband is not fine, it will be difficult for pregnancy to occur. So on this, you've seen that you've done all the necessary checks for you to get pregnant. If you try all of this, you don't conceive, then you have to look at other aspects which we're going to talk, which has to do with your mental health as well, even your weight. These are all part of things that you need to do with respect to your fertility. I wish every lady trying to get pregnant the very best. May the good Lord make it much more easier for you. If you're interested in one-on-one session, just get a number on the screen, pay for a session, and we will discuss. If you're Mamina Cameron, you can access directly. May God bless you. Don't forget to follow, like I said, don't forget to share. Thank you so much. Do have a wonderful time.